Every night, millions of people drift off to sleep without realizing that the way they position their body might be silently increasing their risk of stroke. We often worry about diet, exercise, and stress as contributors to heart and brain health, but very few think about posture in bed. Yet, according to new research and real-life patient stories, something as simple as curling up too tightly or twisting your body the wrong way can dramatically impact circulation to the brain. This article explores the science behind dangerous sleeping positions, the real stories of people affected, and practical steps you can take to protect your health. Let's dive into what brain doctors are now calling one of the most overlooked stroke risk factors: how you sleep. Why sleeping position matters for stroke risk. Sleep is supposed to be a time of healing when the body repairs itself and the brain clears out waste products. But if the flow of blood to and from the brain is reduced during the night, the opposite can happen. Instead of repair, subtle damage builds up. Doctors have noticed that some patients who experience strokes have no major risk factors like high blood pressure, diabetes, or smoking. Instead, their stroke risk is linked to circulation problems caused by body positioning during sleep. When arteries are compressed for hours, blood becomes turbulent, clots can form, and oxygen supply to the brain drops. Over time, this sets the stage for small, silent strokes or even a major, life-altering one. Research shows that some positions can reduce oxygen to the brain by as much as 38% overnight. Symptoms like morning brain fog, dizziness, or numbness may actually be signs of mini-strokes that went unnoticed. The 5 most dangerous sleeping positions. 1. Sleeping on your back with one arm under the pillow. At first glance, this looks like a harmless position, comfortable and familiar, but the pressure it creates is not evenly distributed. The arm tucked under the pillow gets compressed, along with the subclavian artery, which supplies blood to the arm. The risk: compression leads to turbulent blood flow, raising the chance of clot formation. The evidence: a 2019 Johns Hopkins study tracking 1,200 people found a 21% increase in mini-strokes among those who favored this position. Seniors over 60 had 3 times the risk compared to younger participants. A real-life example: Jennifer Martinez, a 58-year-old teacher, experienced weakness in her hand that turned out to be the result of repeated small strokes caused by her sleeping habit. Safer alternative: use a thick memory foam pillow or wedge pillow, so your head is supported without needing your arm. After making this change, Jennifer saw her energy return and no new strokes on her scans. Second, stomach sleeping with head turned. Many people find stomach sleeping cozy, but doctors see it as a nightmare for circulation. To breathe in this position, your head must be turned to one side for hours at a time. This stretches one carotid artery and compresses the other, the main blood vessels supplying the brain. The risk: chronic twisting causes micro tears in arteries, which attract cholesterol and debris, forming dangerous plaques. The evidence: a 2021 University of Michigan study of 2,000 people found stomach sleepers had a 33% higher risk of carotid artery plaque buildup, with arteries that looked 10 years older. A real-life example: Robert Chin, a 45-year-old software engineer, experienced vision disturbances, a stroke warning sign. Tests revealed significant narrowing in his carotid artery from decades of stomach sleeping. Safer alternative: transition with a body pillow that prevents rolling onto your stomach, and use a cervical support pillow to make side sleeping more comfortable. Third, side sleeping with arm under head. This pillow hugger position is the most common. Around 65% of people sleep this way. Unfortunately, common does not mean safe. The bent arm under your head compresses both the brachial plexus nerves and the thoracic outlet, restricting blood flow not only to your arm, but also back toward your brain. The risk: brain oxygen dips dozens of times each night, adding up to hours of compromised blood supply. The evidence: Stanford researchers in 2022 found that people in this position had an average of 43 blood flow reductions per night, lasting up to 3 minutes each. Over years, this led to white matter brain lesions and a 56% increased stroke risk. A real-life example: Maria Rodriguez, a 62-year-old nurse who lived a very healthy lifestyle, developed memory issues. An MRI revealed brain damage linked to decades of this sleeping position. Safer alternative: use a contoured side sleeping pillow that removes the need for arm support. The quarter turn technique, where you lean slightly forward with a pillow, also reduces shoulder pressure. 4. The twisted pretzel. This position happens when your upper body faces one way while your lower body twists in another, often with a leg draped over a pillow. It feels relaxing, especially for back pain, but it can be catastrophic for circulation. The risk: twisting strains the vertebral arteries in the spine, which supply 20% of brain blood flow. Turbulent blood develops, and tiny clots called microembolisms can break off. The evidence: a 2023 UCLA study found this position reduced vertebral artery flow by 67%, with stroke rates at 14% compared to just 3% in normal sleepers. A real-life example: Thomas Anderson, a fit 55-year-old, suffered a stroke despite no traditional risk factors. His twisted sleeping posture after a back injury was identified as the trigger. Safer alternative: keep your body aligned with strategic pillow support, a knee pillow, a small towel under the waist, and physical therapy for back pain so twisting isn't needed. 5. The tight fetal position with chin to chest. This is the position brain doctors fear the most. Curling tightly with your chin pressed into your chest compresses both the carotid arteries, inflow, and jugular veins, outflow, choking off circulation. The risk: blood flow to the brain can drop by nearly 45%, while venous blood cannot drain properly, creating a traffic jam. The evidence: a 7-year Harvard Medical School study showed participants in this position had 112 episodes of reduced flow per night. Stroke risk was 11 times higher, and among seniors, 92% showed silent strokes, while 37% suffered a major one. A real-life example: David Thompson, a 68-year-old retiree, suffered multiple strokes linked to years of anxiety-driven fetal sleeping. Rehabilitation, sleep position training, and therapy for anxiety turned his health around. Safer alternative: use a C-shaped pregnancy pillow or even a soft cervical collar at night to prevent curling too tightly. The best sleeping position for stroke prevention. So, if many of the common sleeping positions are risky, what is safe? Doctors recommend what they call the cardiovascular neutral position. Here's what it looks like. Sleep on your back. Elevate your upper body slightly, about 15 to 30 degrees, using an adjustable bed or wedge pillow. Support your neck with a cervical pillow that keeps the natural curve, preventing your chin from dropping forward or tilting back. Place a small pillow under your knees to ease pressure on the lower back and stop sliding. Add side pillows if needed to prevent rolling. Why it works: promotes free blood flow into and out of the brain, reduces risk of arterial compression, works with gravity, not against it. Bonus benefits: helps with reflux, snoring, and sleep apnea, all of which independently raise stroke risk. Studies show this position cuts stroke risk by 43% compared to the more harmful postures. How to transition safely. Changing sleeping habits is not always easy, especially if you've been in one posture for decades. Here are some tips to make the switch gradual and sustainable. 1. Start small. Spend the first 30 minutes each night in the cardiovascular neutral position before allowing yourself to roll. 2. Use pillows as barriers. Place them on both sides so you don't unconsciously move. 3. Choose the right equipment. A wedge pillow or adjustable bed makes the process far more comfortable. 4. Set reminders. If you wake up during the night, reposition yourself. Some even use smart alarms or wearables. Be patient. Within 2 to 3 weeks, most people adapt completely. The bigger picture: sleep and brain health. Sleeping position is just one part of the bigger puzzle. Stroke prevention also involves managing blood pressure and cholesterol, staying physically active, eating a diet rich in fruits, vegetables, and omega-3 fats, avoiding smoking and limiting alcohol, treating sleep apnea if present. However, what makes posture so important is that it's something you control every single night for 6 to 8 hours. It costs little to nothing to adjust, but pays enormous dividends in brain protection. Conclusion: 8 hours at a time. Every night, your sleeping position is either protecting your brain or putting it at risk. While many common postures feel comfortable, the science is clear. Positions that compress arteries, twist the spine, or curl the neck too tightly can raise stroke risk dramatically. The good news is that solutions exist. By shifting to the cardiovascular neutral position, back sleeping with gentle elevation, you give your brain the oxygen and circulation it needs to stay healthy. Think of it as one of the most important health decisions you make, repeated every single night. As one doctor put it, you are literally adding healthy years to your life, 8 hours at a time.